environment is safe, no risk for trips and falls. I will close the curtains to provide privacy and immunity to my patient. And since my hands are visibly clean, I'll just do a quick hand rub following the 6-step guidelines of WHO. Show me my hands are dry, so now I'm ready to approach my patient. Hello, good afternoon. My name is Anne. I'll be your nurse for today. So I am here to give your medication at 12 noon. Is that okay? Okay. So for confirmation that I have the right patient with me, could you please state your name and date of birth as I counter check it with your wristband and prescription chart?
Okay, I'm L. Smith, 1st of 1st, 1994.
How do you want me to call you?
You can call me L.
L, do you have any allergies to food, medication, latex, or others?
Yes, to penicillin.
So what type of reaction do you experience when taking penicillin?
Anaphylaxis.
Anaphylaxis. So I'll take note of that, making sure that everyone is aware so you will not be given penicillin. Okay? Are you comfortable?
Yes.
Are you in any pain?
No.
No. So L, I'm just going to read the prescription chart with you so we can check your medications, okay? So this prescription chart is for L. Smith, hospital number 004823, date of birth is 1/1/1994. Your address is 1 Sweet Street, Northampton, and 227AL. You're admitted today at 7:30 a.m. You're allergic to penicillin and your reaction is anaphylaxis, which is noted and signed by Dr. A. Kumar. Yes, I have documented that you have allergies, so you are admitted at Medical 1 under Dr. M.R. Darzi with height of 5 foot 2 inches and weight of 60 kilograms. Height and weight are essential for calculating the right drug dosage. And I can see that you have a special dietary requirement, which is vegan. Is that correct? Yes. Yes, I have documented that you have allergies. So for your once own instant doses, you had paracetamol 1 gram IV at 7:40 a.m. signed and prescribed by Dr. Zikan, lip number 123, given by Nurse Angela Jones. You also had salbutamol 5 milligrams via inhalation at 7:40 a.m. signed and prescribed by Dr. Zikan, lip number 123, given by Nurse Angela Jones. For your prescribed oxygen therapy, I can see that you had oxygen via non-rebreather mask with continuous therapy instructions at 15 liters per minute. Started at 7:40 a.m. by Nurse Angela Jones, prescribed by Dr. Zikan, lip number 123, and it was discontinued at 12 o'clock by Nurse R.N. Jones. Are you having shortness of breath?
No.
Assessor, what's the latest oxygen saturation of the patient?
98.
98, okay, so you don't need any oxygen therapy. For your PRN medication, you have paracetamol 1 gram per hour for pain every 6 hours, signed and prescribed by Dr. Zikam, lip number 123. Do you have any pain? No. You also have salbutamol 200 micrograms, 2 puffs by inhalation for shortness of breath, signed and prescribed by Dr. Zikam, lip number 123. Are you having shortness of breath? No. Yes, I have documented that you have allergies. So for your antimicrobials, you have amoxicillin 500 milligrams 4 times a day per hour for 5 days. To start today to be finished in 4 days. However, you're allergic to penicillin and amoxicillin has penicillin derivatives, so I'm not going to give this. I'm going to ask the doctor to remove it in the system so we will not give it to you accidentally. Okay? So I'm just going to write code of 2 so that I will omit this medication for clinical research. Yes, I have documented that you have allergies. So for your regular medications, you have levothyroxine, 100 micrograms twice a day per hour for 5 days to start today to be finished in 4 days. Signed and prescribed by Dr. Zikam, lip number 123. It's due at 12 o'clock, so I'm going to give this. You have also beclomethasone dipropionate, 200 micrograms, 2 puffs twice a day by inhalation for 5 days. To start today to be finished in 4 days, signed and prescribed by Dr. Zikam, lip number 123. It was last given at 8 o'clock in the morning by Nurse Elizabeth Kim. Is that correct? You also have salbutamol, 200 micrograms, 2 puffs, twice a day by inhalation for 5 days. To start today to be finished in 4 days, signed and prescribed by Dr. Zikam, lip number 123. Last given at 10 o'clock in the morning by Nurse Esme Matthews. Is that correct? And the next dose will be given at 10 o'clock this evening. You also have prednisolone, 30 milligrams twice a day per hour for 5 days to start today to be finished in 4 days. Signed and prescribed by Dr. Zikan, group number 123. It's due at 12 o'clock, so I'm going to give this. Okay? Yes, I have documented that you have allergies. So for your intravenous fluid therapy, you have 0.9% normal saline. You had 0.9% normal saline, 500 ml for 4 hours, signed and prescribed by Dr. Zikan, group number 123. with batch number of 00453621, commenced at 7:30 a.m., given and checked by two of my colleagues, and it was finished at 11:30 a.m. You have a second bag which is currently running. You have 0.9% normal saline, 500 ml for 4 hours. Signed and prescribed by Dr. Zikam Lip number 123. Batch number is 00453621, 00453621. It's the same. Expiration date is 11/20/21. There is no settlements noted. Started at 11:30 a.m. Given and checked by two of my colleagues, and it is expected to be finished at 15:30. L, is it already filed? Check your intravenous site. Is there any pain? So I can see there's no signs of inflammation or infection, so it's patent. Okay, Al, before I prepare your medication, I'll just document the drug I will not administer, okay? So I'm going to document the date today, so 02/09/2019. Time is 12 o'clock. Drug is amoxicillin, 500 milligrams. Reason is patient is allergic. And then I will sign the medication. Right, L. I'm just going to prepare the medication. If you need anything, the call bell is with you, so just press the red button, okay? So when preparing the medication, if I'm not familiar with the medication, I will use the BNF. But since I'm already aware what the medication is for, I'm not going to use it. So I need a clean tray and a clean medication pot. So when preparing the medication, I need to observe the 3-time check when giving the medication. So first time check when getting it from the cupboard. So first medication is levothyroxine. So levothyroxine, 100 micrograms twice a day. Expiration date is 2020-05, so it's dry and intact. And next medication is prednisolone. Prednisolone, 5 milligrams per tablet. Expiration date is 06/2020. So I need 30 milligrams, so I will need 6 tablets to make it 30 milligrams. Second time check is before dispensing the medication. So levothyroxine, 100 micrograms, expiration date 05/2020. So I'll be needing 1 tablet. So when dispensing the medication, I need to observe aseptic non-touch technique. So there's an excess tablet, so I'm going to use a clean spoon to remove the excess tablet and throw it in the sharp bin. Assuming I've got the clean spoon. The next medication is prednisolone, 30 milligrams twice a day. Prednisolone, 5 milligrams per tablet. Expiration date 06/2020. So I need 6 tablets. 1, 2, 3, 4, 5, 6. Throw it in the sharp bin. Then third time check is before returning the medication to the cupboard. So prednisolone 5 milligrams per tablet. Expiration date 06/2020. So I've got 6 tablets. Levothyroxine 100 micrograms. Expiration date 05/2020. I will always make sure that the cupboard is locked to prevent unauthorized access. So now I'm ready to go back to my patient. Hello, I'm back. So for confirmation that I still have the right patient with me, could you please state your name and date of birth as I come to check it with your wristband and prescription chart?
L. Smith, 1/1/1994.
Right. Do you have any allergies to food, medication, latex, or others?
Yes, to penicillin.
Right. L, just want to reassure you that the medications you're gonna take doesn't contain penicillin, okay? By the way, can you swallow multiple tablets? Yes, and I will sit you upright so you can swallow the tablets properly. And I need to observe as well when giving the medication the 5 rights. So I have right patient, right drug, right dose, right route, right date and time. Do you want water or juice to go with it?
Just water.
Just water. So by the way, do you know what the medications are for?
No.
No, so levothyroxine is for your hypothyroidism, and it's a supplement. And your prednisolone, it's an anti-inflammatory, so that you can help you for your breathing, okay, to reduce the inflammation on your chest. Right. The common side effects would be sweating, lightheadedness, and gastrointestinal upset. But those are just temporary, okay? So let me know if you swallow the medication. So this is your water. Swallowed. So I'll just sign the medication. So signature and the date today. Signature, date today. Right, so Elle, we're done with the procedure. If you experience any untoward reactions like shortness of breath, rashes, or itchiness, I'll do this with you. Just press it and so that we can sort it out immediately. Do you have any more concerns? None. Right, thank you for your cooperation.
Thank you.